Peace, love, and blessings, fam. Johnny Sally here, not your traditional life coach. Now, today, October 10th, is World Mental Health Day. Being an Iraqi war veteran that has dealt with PTSD for a large portion of my life since returning home from the military, it's a topic that I feel needs more focus on. It is a topic that needs awareness brought to it because so many of us, especially in black and brown communities, deal with cognitive distortions or mental paradigms that have been passed down to us either genetically or through societal norms. And we're just taught that we have to just deal with it. It's okay. And you're weak or you lack a sense of pride to acknowledge that you have something that needs to be worked on mentally or behaviorally. Statistics from Mental Health America say that 18% of adults actually have a mental health condition. Now, that's over 43 million Americans. Nearly half of them having a co-occurring substance abuse disorder and 9.6 million experiencing suicidal ideation. 2.2% of that suffer from PTSD, which puts that number at a whopping 7.7 million. Many of them, but not exclusively, being Iraq and Afghanistan war veterans. There are many civilians that deal with PTSD as well that don't even realize it based on certain traumatic experiences they've dealt with in life. Now in 2018, the statistics show that 56% of individuals with mental health issues did not receive treatment. 7.7 actually had no access to mental health services through private insurance. And in a 5-year period, the rates of severe youth depression, I will say that again, severe youth depression has increased from 5.9% to 8.2%. Now, that's over 1.7 million youth with major depressive episodes that do not receive treatment. There's also a shortage of providers, and the lowest ranked states, their providers would have to actually treat 6 times as many patients than providers in the highest ranked states. All right, let's run through some more stats right quick on mental illness in America. As far as the American population, 1.1% suffer from schizophrenia, 2.6% major depressive disorder, 18.7% anxiety disorder, and 31% have a co-occurring mental health and addiction disorder, meaning they may have anxiety, depression, split personality, and they're also struggling with alcohol, hard drug use, or prescription drugs. 1/10 of children between the ages of 5 and 16 have a diagnosable condition. That's not even saying if that condition has been identified. It's just saying they have a diagnosable condition. Half of all mental health problems are established by the age of 14, and 3/4 of all mental health problems are established by the age of 24. Now, 1 in 5 American adults will have a diagnosable mental health condition in any given year. 50% of Americans will meet the criteria for a diagnosable mental health condition at some time in their life. And just like I stated previously in the last slide, half of those people will have developed those conditions by the age of 14. Let's look at the numbers. Percentage-wise, 13.2% of us identify as Black or African American. 16% of that had a diagnosable mental illness in the past year. That's 6.8 million people. 17.8 of us identify or have been established as Latino or Hispanic. 15% of that number had a diagnosable mental illness in the past year. That's 8.9 million people. 5.4% of us identify as Asian American or Pacific Islander. 13% of that number had a diagnosable mental illness in the past year. That's another 2.2 million people. Half of the U.S. population identifies as Native American or Alaskan Native. 21% of that 1.2 equals 830,000 people. As far as post-traumatic stress disorder, 2.2% of the population, that's 7.7 million people, with 11 to 20% of the population being veterans of the Iraqi and Afghanistan wars. That's 300,000 people. Other statistics have come up with the numbers that 10% of those are women, 5% are men, and that's not even including the civilians. So with 18,730,000 people dealing with some form of mental health issue or illness or distortion cognitively, I think we have to actually admit that this is something that is detrimentally in need of focus, in need of more programs in our communities. This isn't even touching on the level of those who may have been institutionalized due to prison or group homes or things of that nature, because that opens up a whole nother avenue. Because if you've never been incarcerated, you would never be able to understand what it's like to be in solitary confinement for 23 hours a day, either in completely dark rooms or just sitting there by yourself all the time. So if you believe you have a mental health distortion or a mental health issue, if you struggle and are continually dealing with anxiety or depression or other things of that nature, I implore you to seek help, seek medical attention, talk to somebody, talk to a family member or a friend or someone that you can confide in that won't bring it back up in your face or won't call you crazy later on in life when you step into cruise control and do these things that you may not even be able to acknowledge that you are doing. Gather yourself around other individuals who may be able to help you deal with these things. Gather yourself around friends who are sincerely honest to let you know, hey brother, hey sister, I notice you do this and I don't know if you realize you do, but I think we may need to look deeper, because this can affect very many areas of your life, of all of our lives. It's not just you it affects. It's the next person that individual may deal with, because we can pass on negative and positive energy. I say that sincerely because you never know how you dealing with one person can cause another person to be in a state of anger or distrust and deal with the next individual like that. And it's like passing on a state of hurt, because we know hurt people hurt people. So again, if you know someone or you deal with certain mental health anguishes, seek help. Don't be afraid to tell somebody, I need help because I'm going through these things, because for some, it could be the matter of life and death. Know that you are loved, walk in peace, and know that I love you. Johnny Sally, Loyalty Life Legacy, and I just want us all to do better for ourselves and for the community and for the world, so we can all reach that level of higher self to be able to love unconditionally. Peace.